Welcome to the Future Strong podcast. This new article in the BMJ Mental Health Journal has really got me thinking about the connection between the body and the mind. It's arguing that in psychiatry, we should be considering the menstrual cycle as a vital sign.
Wow, it's great to be here.
Yeah,
I think it's safe to say the connection between the menstrual cycle and mental health has been a bit of a blind spot in our field.
totally. It's like we finally have this crucial piece of the puzzle, but we haven't quite figured out where it fits yet.
Yeah.
One of the things that really surprised me was that the perimenstrual phase, those days leading up to and during your period,
Right.
is linked to a much higher risk of things like psychiatric hospital admissions.
Oh, wow.
And it's even associated with a greater risk of suicide attempts. I mean, those are some pretty sobering stats, don't you think?
Yeah, you're right. The numbers are concerning.
Yeah.
And it makes sense when you consider the intense hormonal shifts happening during that time. It's not just about the hormones themselves, though. Societal stigma surrounding menstruation plays a role,
Right.
and so does the lack of consistent support for women who are struggling.
Yeah, the article talks about a woman named Stephanie Allen who has schizophrenia.
Okay.
She actually found that her hallucinations and sleep disturbances were way worse right before her period. Her story really puts a human face on these statistics.
Stephanie's experience is incredibly important.
Yeah.
It reminds us that everyone's experience is different
Yeah.
and that we need to listen to our patients and understand how the menstrual cycle uniquely impacts their mental health.
Yeah.
This is where the idea of the menstrual cycle as a vital sign becomes so powerful, right?
Right.
If we're tracking these changes and taking them seriously,
Yeah.
it can lead to better diagnosis and more personalized treatment plans.
Absolutely.
It's like we're finally acknowledging that women's bodies and brains are intricately connected,
Yeah.
and those hormonal shifts throughout the month can have a real impact on mental well-being.
For sure. Okay, so
Yeah.
we've talked about the risks. But this article also suggests some pretty exciting possibilities when it comes to treatment.
Oh.
I'm talking about the potential for using hormonal treatments, similar to what's used for PMDD, to help with other mental health conditions.
That's an area of research that's really starting to gain traction.
Yeah.
And the early results are promising.
That's great.
We've seen studies where estrogen therapy, used as an add-on treatment for women with schizophrenia, has actually helped reduce their hospital admissions.
That is huge.
It's pretty remarkable.
It seems like such a simple intervention.
Right.
But if it can keep people out of the hospital and improve their quality of life, that's a major win.
It is.
Yeah.
But even without complex treatments, there's a lot we can be doing right now.
Oh, okay.
This article really emphasizes how powerful it can be for doctors to simply ask their patients about their menstrual cycles.
You mean just incorporating that into a regular checkup or mental health evaluation?
Exactly. That one simple question can open up a whole new level of understanding. Okay. It helps us identify potential triggers, recognize patterns and symptoms, and ultimately create treatment plans that are more effective and tailored to the individual.
Yeah.
Think about it. If a woman knows that her anxiety tends to spike a week before her period, she can work with her therapist to develop coping strategies specifically for that time.
Yeah, that makes a lot of sense.
It's about being proactive and giving women the tools they need to manage their mental health.
It's like having a roadmap for your mental health throughout the month.
Right.
You know, where those bumpy patches are likely to hit, and you can be prepared.
And on the flip side, if a doctor notices that a patient's depression always seems to worsen in the luteal phase, maybe that's a clue to explore hormone-based treatment options or even consider underlying conditions like PMDD.
It feels like we're finally starting to have a more holistic conversation about women's health, acknowledging that the menstrual cycle is a vital part of the picture.
Yeah.
But I have to ask, if this connection is so important, why has it been overlooked for so long?
Well, there's a long history of societal stigma surrounding menstruation and women's bodies in general.
Right.
It's something we're still grappling with today.
Yeah.
And unfortunately, that stigma has seeped into the medical world as well.
So it's not just about the science catching up. It's about shifting cultural attitudes, too.
Exactly. We need to break down those taboos and create a culture where women feel comfortable talking about their menstrual cycles, both with their doctors and in their everyday lives.
Okay.
It's about recognizing that this is a normal biological process, not something to be ashamed of or hidden away.
You're right.
It's time to bring these conversations out in the open.
Yeah.
And that means educating not just healthcare providers, but everyone about the menstrual cycle and its potential impact on mental health.
Yeah, I agree. Education is key.
Right.
We need to equip doctors, therapists, nurses, everyone on the front lines of healthcare, with the knowledge and tools to confidently address these issues with their patients.
Yeah.
And it's not just about medical professionals.
Right.
We need to educate the public as well.
Yeah.
Imagine a world where young girls are taught about the menstrual cycle and its connection to mental health from a young age.
I know.
That would be a game changer.
That's a powerful vision.
It could really help to destigmatize these conversations and empower women to advocate for their own health.
Absolutely.
And on a broader level, we need to continue to push for systemic changes that support women's mental health.
Right.
This includes things like access to affordable mental health care, paid leave for mental health reasons, and protection from discrimination based on mental health status. It's about recognizing that mental health is health, period.
Right.
And that means investing in the resources and policies that will allow women to thrive.
Well said.
Yeah.
It's about creating a society that values and prioritizes women's well-being, both mentally and physically.
Yeah.
And that's a future I'm excited to work towards.
Well, this has been such an eye-opening conversation. Thank you so much for sharing your expertise and insights with us today.
It's been my absolute pleasure. I'm so glad we had the chance to dive into this important topic.
And to all of our listeners, thank you for joining us on this journey. We hope this episode has sparked your curiosity and empowered you to learn more about the connection between the menstrual cycle and mental health.
And remember, you're not alone. There are resources available, and together we can continue to push for progress and understanding.
Until next time, stay curious, stay informed, and stay strong. We'll see you on the next episode of the Future Strong Podcast.